morning, Mom. I am Maria-Paula Valenzuela, your nurse for today. May I know your name, Mom? So, Miss Kylie, today we will be having a perineal care. So, which is to prevent the bacterial infections and to give you comfort and promote healing. So, before we start, I will draw the curtain and to provide a privacy and comfort to you. So, next, I will now gather all the equipments. So, we have gather all the equipments that we will need it. So, we have irrigation solution. So, we assume that it is a irrigation solution. So, what else? We have forceps. And we have also alcohol. And we have also here cotton balls, a basin with a warm water with soap. So we assume that there's a water with soap here. So we have also disposable gloves, and we have also a toilet. We call this toilet tissue or diaper wipes, perineal pad, and medical records. So, I will now do the hand washing or hand hygiene this is to prevent transmissions of microorganisms. So after that, I will now fold the linens. And now I will put the underpad. This is to prevent the linen becomes sore. So I will turn to you. I will now turn you to the left, Mom. In the count of 3. 1, 2, 3. And you will now face me, Mom. In the count of 1, 2, 3. And then after that, I will now apply the gloves. Then after we apply the gloves, I will now cover the patients using the bat blanket position. So I will now cover her body, exposing only her perineal part. So, after that, now she in a right position. She is in a backline position, and her knees will bend apart, spread apart to have an access and visibility. And after that, we will now start to wash her perineal area using the forceps. Using the forceps, I will now get a cotton ball and soak it in a warm water with soap. And then spread apart the labia majora. Then to cleanse the labia minora. So using a 7-stroke, then discard. Then get another one cotton balls, soap, then discard. And then I will now cleanse the labia majora, soak it in a warm water, and then use the 7-stroke. And then get another one, soap, and then discard. And then soak another one cotton balls and in the middle, and then discard. And after that, we will now rinse it well using irrigating solution. And we will now pour it. And then give paying attention on the folds between the labia because moisture there intersticollects and promote the bacteria growth. And then dry it using a cotton balls. The labia minora. The labia majora. And then the middle. After we cleanse the perineal part, we will now cleanse between the buttocks. So ma'am, we will now turn you facing away from me in the count of 3. 1, 2, 3. Paying attention to anal because there's a dirt or microorganisms between her buttocks. So we will use the toilet tissue. So the toilet tissue, assume that this is a toilet tissue to cleanse the anal area. And next, we will now cleanse it with warm water and soap. We will now soap. I get another cotton. Soap it. Then discard. And then we will now pour irrigation solution to her anal and dry it well. And after we cleanse or dry the anal part, after we cleansing, we will now get the waterproof pads. So, ma'am, we can now wait. So, ma'am, you can now turn to the right. So, in the count of 3, 1, 2, 3. Then you can now face me, ma'am. In the count of 1, 2, 3. And then discharge the pad and position the patient in a lying position. And after that, we will now remove our gloves. So, make sure that the gloves do not touch your hands to prevent the transmission of microorganisms. So, we can now discard to the trash bins. And now, we will now do the hand hygiene to prevent a transmission of microorganisms. And after that, we will now document the procedure. So, describing the client's skin conditions, skin breakdown, discharge, or drainage, and any localized areas of tenderness and tolerance to the care. This is to provide continuity of care.